Multiple myeloma is a cancer where plasma cells grow out of proportion to the other cells, and because of that, they can cause different symptoms, and that's how we diagnose it. Some people come because they're just tired and a blood count shows that things are abnormal. So sometimes patients will come to us with a new fracture or a new break in the bone somewhere in their body. Or the myeloma cells can also produce proteins and cause you to have kidney failure. And so some people may show up and say, I'm not going to the bathroom anymore, I don't know what happened. And this can be a sign of multiple myeloma as well. Multiple myeloma can be classified into different stages. We tend to do it based on how risky the myeloma is. And so in order to understand that, we will always look at the myeloma cells, most often in the bone marrow, and look at DNA changes. Sometimes the DNA can be different because there are parts of it that are missing, and this is what we call a deletion of a DNA part. And if that is true, that tends to put people in a high risk. There are other changes you can have in DNA where two pieces break off and mismatch with another part, and that's what we call a translocation. In the absence of those altogether, people would say that you might have intermediate risk. For example, if any one of those is different, a different combination of those changes, or perhaps an elevated blood level of an LDH, or something called a beta-2 microglobulin, may put someone either in a high or in an intermediate risk. And if none of those are different, we would say that you have low risk. This is still considered an incurable disease, but we want to make sure we make people understand that it's a disease that you can live with, not necessarily have to die of.